I actually started this journey about 30 years ago. My brother John had taken his life. He was age 20. So at that time, I promised myself and family that this would be my journey to find purpose for my pain, meaning we wanted to make sure that as many people as possible kind of had some support and understand what they could do as a family and or friend to help prevent other people from going through what our family did.
Pretty much all my life, I've been involved in community health work. So I find myself now, at this moment in time, working in a state and in a region that really is calling upon every single one of us to become involved.
For me, I think being a psychiatrist and working in the mental health field is really an honor. And looking deeper into our emotional states and our behavioral states is really difficult and not always apparent.
The reason I went into research and was studying mental health interventions for K-12 schools is because as an assistant principal, I really wanted to be able to help and support our students, but there weren't necessarily a lot of interventions that we could immediately put in place to help those students. And that's where we want to come in and be able to help and support and increase the information available to students so they know where to get help, be able to increase access so students can get help, and then make sure that they're getting quality care that they need.
Like many of the complex problems, it takes a village. So physicians on their own cannot do it. I mean, you need social workers, you need psychologists, you need law enforcement, you need the philanthropic arms, you need community leaders, grassroots efforts. So one of the projects we have is a mental health partnership that brings multi-stakeholders in the region to address one common issue most of us care about and are passionate about.
For years, it was like we were sort of on an island by ourselves, and just to see this new generation of healthcare providers and this university coming together to open up the idea of working together, building some partnerships, and making this really a healthier community all around.
Really, it's mutual learning and sharing when I'm in forums and meetings with the community and how we might, and really figuring out how we might engage our work together.
We have been able to participate in initiatives in the region to help increase access, increase quality care, and develop innovative models for the future.
It's great to be able to wake up and know every day that I go to work that I'm going to be helping people, whether that's directly or indirectly. And personally, it's extremely fulfilling to know that I can be a part of the system to help proactively address the mental health crisis in the Great Lakes Bay region.
My hope, my vision, my dream is that every single individual will have a circle of care around them.
That they get the same treatment, the same healthcare benefits to treat themselves mentally, emotionally, as we do for anyone with physical illness.